All right, I think that's about it. So hello everyone, so we're doing nasotracheal suctioning today. And so to do that first before going in the patient's room, you do want to check the chart, make sure there are no contraindications going on, no contradictions, no bleeding disorder, laryngoscopy, no epiglottitis, anything like that. Once we've done that, we're going to knock on our door to gain entry to our patient's room, introduce ourselves, who we are, let them know the reason we're there. Do our 2 patient identifiers with our arm badge here. We're going to go ahead and wash our hands, dry them off. So we're going to go ahead and place our suction catheter kits here, taking out, removing everything from the tray. We take our nasal saline, put it at the bottom of the tray. We're going to take a clean glove and put it on our dominant hand, and we're going to take a sterile glove that's actually in the kit and put it on our non-dominant hand. But prior to doing that, before you place your gloves on, you want to go ahead and hook up your suction tubing to the suctioner there. You put a drape on our patient and place it right up under their mask here, going across, so make sure we don't get anything on them. They are on oxygen, so we're going to beef them up to 100%. Okay, so we're going to go ahead, like I said, put our gloves and everything on now. We're going to hook up our suction catheter to our suction tubing. We're going to go ahead and place in our suction catheter in there to kind of run it through, clean it out, make sure everything is working just properly before we go suction patient. I'm going to go ahead, I guess I should put on the glove. I want to go ahead and when you place in the catheter nose, you just want to follow the patient's nose around. Through the nares, all the way down to the septum. Okay, so did not feel any resistance. We're going to go ahead and suction patients in 15 seconds. Just removing it, we're going to twist gently, bringing the catheter out of the nose. We're going to go ahead and make the patient cough. To cough, we're going to go ahead and place our suction catheter in our dominant hand, which is in our clean glove. Take that off. I'm going to go ahead and take off our sterile glove. We're going to disconnect our suction tubing. But you know what I did not do? Prior to you doing that, you want to go ahead and clean out that catheter. And you're just going to go ahead and stick it in that saline where you had before in the tray. Put a little bit here. Clean it out. Alright, then you're going to follow those steps. Like I said, disconnect. We're going to go ahead and put our patient's mask back on. Remember they're 100%, but you want to place them back on the leader flow that they were on prior to us taking them to 100%. Then we're going to assess their cardiopulmonary status. Make sure we clean our area up, find if there's anything we can do for the patient prior to leaving out of the room. Once we leave out of the room, we're going to go ahead and chart. We're going to compare our patient assessment after doing the suctioning and what they were before.